Hey there, it's Dominique Well from Well Medical Arts, and we get to show you one of our favorite procedures, mid-face thread lifting. So these are PDO threads. They're made out of dissolvable PDO suture material. These actually have little teeny tiny cogs in them, little hairs that are going to attach to the skin so that the skin can literally reposition and lift. So I've gone in, we've arnica'd, we've cleansed, we've lidocained, and now we're gonna go in and show you the threads. I'm gonna have you gently turn to the side. We have me a 4x4 and a thread. Thank you so much. And perfect. These are actually so easy. So I've already created a little portal. There we go. Well done. How you doing? Can you feel anything?
No, just the
Pressure?
Pressure.
Yeah, great. That's what we want. And so I get as numb as I can all the way down. You might feel a little bit past the area that I'm able to know. There it is. I attach the thread and then it's out. So it's very quick and easy. And then I'll show you. Let's make sure that when you look at the thread up close, you can actually see those little cogs that I'm talking about, how they attach. And in particular, this is considered a molded thread, which is one of the stronger threads. And I get it to attach. Sometimes you can hear the thread attach and kind of click. And then you can also see that repositioning, how much it pulls and lifts. Isn't that magnificent? And then let's do the next one. And here is thread number 2. There we go. Trying to stay right in the same plane, even past the curves. Okay, you're numb. This is going into the area that's not that numb. Hang in there, baby. I won't be here long. Breathe, breathe. Get it attached, and you're out. Well done, you did so good. How was that? 0 to 10. 0 is 10. 0 is 9 and 10's the worst of your life. A 2. Good. So all of these look kind of terrible to watch. They are actually very easy to do. And now, easy for the patient. There we go. And now you can see this lift right through there. We got it down there. Is that tender down there?
It's okay.
It's okay. Good. Alrighty. Next thread. Great. Great, great, great. Great, great, great. Hang in there, mama. Breathe. Breathe. Got it attached. You're doing great. And it's out. Yay. So good. How you feeling?
Fine.
And look at this great lifting. That's the last one I put in. Here's the second one. And here's the first one. So you can see the lifting in all of the different areas. Now, I like to leave this side in. Can you hear that? You can hear sometimes a little bit of a clicking as they attach at the top. There we go. Let's take a look and see how much lifting this side got in the mirror.
That looks good. Oh yeah.
So try not to look at this. This is funny. Just look at the lower face lifting.
Oh, now I was looking at the wrong area. Yes. Very nice.
Yeah, can you see how this is all nicely lifted?
Yes, very nice.
Mm-hmm.
Cool.
Yeah. I know, these are funny to look at. So
I'm glad I watched.
There it is. Good job, babe. Good job. Breathe. And you made it. Seemed like that side was a little bit more tender, was it?
Just a little bit.
Mm-hmm. Perfect. Look at that lift. That looks great. So very natural. wonderful tool to get that lower face to lift without putting any filler in it. We don't like to put too much filler in the lower face because we don't want to make the bottom face heavy. Good job. Relax. Good job. Breathe, breathe, breathe. There it is. Yep, there's that tender area. And thank goodness it's out quickly. Good job. Well done. All right, did you hear that click?
I did hear that click.
Yes. Super great. And our last one this side. There we go. Thank you. Come on, baby, let me in. Good job. There it is. Keep breathing. And one more time, you made it. Yay. Super great. So look at, there's the nasolabial one. There's the gel one, and there's the marionette one. And all three together, look at the lift. Isn't that neat? Yeah. Looks beautiful. So now I'm going to cut them down.
You don't want to leave them?
Yeah. We
Look
don't
like
really-
a kitty cat.
I know.
In joking, we call them whiskers.
They
That's
look like
exactly right.
whiskers.
So you want to go ahead and push down so that none of them are near the surface, and then cut. So same thing, kind of pulling it, getting a few clicks down. There it is. There. Did you hear that? I can feel it. I can feel it attaching and kind of covering up. Now, as far as instructions for afterwards, you want to wash your face lifting up in this direction. Up, up, up. This is just great. And then you don't want to make any large facial movements. Open your mouth too wide. Try to suppress a yawn because this is going to feel nice and tight. Now, you can notice this side just has a little bit more tissue trauma around it. When I went to make the pilot hole, it bled a little bit. This side has hardly any, right? Very, very normal. Just like when you get a shot, sometimes for immunization, one side will hurt, one side won't, one side might bleed a little bit, one side not. It's all very normal. Not to worry, it'll heal just fine. So come down and then cut. And toss that, bring that a little closer. There we go. Same thing, couple clicks down, and then cut. And yes, so great. And then there, I absolutely could hear and feel that attaching. How do you feel now?
Fine.
Does it feel kind of tight and lifted?
Yes,
Yes.
it does.
Yes.
I don't want to even open my mouth.
I know exactly. So you'll feel that for a little while. It'll feel like, wow, I can feel them in there. Next thing that we're going to do, so we did this point, which is going to really lift up. The next thing that we're going to do on Christina is one above the jaw to pull back this way, one underneath the jaw to pull back this way, and one in the high neck. We can also go in and do some fine ones under the chin. I don't think you're going to need that one, honestly.
Okay.
A little bit of topical arnica for healing. So you can see we've just got a really nice lifting. Fairly easy. Would you say 0 to 10? 10, 0 is no pain and 10 is the worst in your life. How bad was the worst one?
2.
2. With minimal pain She'll have minimal downtime. This side might be a little bit tender and swollen. This side not. And then really nice lifting. And these are fairly cost effective. I consider these a real win. Everybody that's done them so far is very happy. Might feel a little bit tender and might be a little swollen. That's normal too. I was actually just a tiny bit more tender than I was expecting to be. Other than that, absolutely great. Yay!
Yay!
Take a look at both. Let me set you back up.
What is that?
Yeah, that is better, right?
Yeah.
What do you think?
Yeah, I can see it. That's so strange. I think I got
Yeah,
this
it is
thing.
strange, isn't it?
Yeah.
Turn towards me, let me see. So, nice, had a little bit of swelling,
Mhm.
that side bled a little bit.
No, it's definitely, it's lifted.
Yeah, and as you're washing your face, lift up a little bit and just be gentle at first.
Will do.
So this is a little warm compress and topical arnica afterwards. And we want to show you a couple things so you guys know what absolutely can be normal. Remember, this side did not swell or bleed, and you're not seeing any kind of tissue trauma and looks absolutely perfect, unaffected. You're like, oh my gosh, you didn't even have anything. And then over on this side, you can see a couple things. One, tissue trauma from the insertion site from the pilot hole. There's a little bit of swelling right around here. And then there's also, probably from the lidocaine and from the tissue trauma, you can see this is, when you push on it, the whole thing moves. That's called fluctuance. That's how you know that it's swelling. It's not a bump, there's a little bit of swelling. And then there's just a little bit of an indent in between the pilot hole swelling and the fluctuance swelling. As she heals, she's just going to be smoothing up gently when it's not tender this way, and also where it's kind of attaching and pulling tight a little bit. It will all resolve and settle down. And so we have people do warm compresses for comfort and to vasodilate. So that's the warm compress. Put the wet washcloth in the microwave for 25-30 seconds. Do a few cycles of it because it gets cold fast. And then once it's not too tender, gently upward.
Should I also start from down here and go up, or just do what you're doing?
And your lymph nodes are all over here to clear it.
Mhm.
So you really think up and out,
Okay.
right?
Got it.
Towards the lymph nodes and down. It's actually a massage technique we call lymphatic drainage.
Great.
Mm-hmm. Is that tender when I do that?
No, it actually isn't.
Good. I'm glad it's still numb. It might
Yeah, it's
it might
still
be a
numb.
little bit tomorrow.
Yeah.
Just
Okay.
wanted to show you so you know it's normal. There we go.